In August of 2018, I was diagnosed with endometriosis. I had very painful periods to the point that I would vomit and pass out. I missed school at least once a month, and I missed out on so many events with my friends and family because of how much pain I was in. And it truly had an impact on my life. So today, I'd like to talk to you about endometriosis and how it affects women everywhere every single day. So I received my diagnosis almost 3 years ago, so I feel confident talking about this subject because of my personal experience as well as from the advice and information that I've received from my doctors over the years. So first, I want to talk about the symptoms that you experience with endometriosis. Second, I want to talk about the complications you experience with endometriosis. And finally, I want to talk about the treatment options that you have once a diagnosis has been made. So now that I've introduced the three topics that I'm going to be discussing today, I want to talk about the symptoms first. So the symptoms of endometriosis can be excruciatingly painful, as I mentioned before, and they can prevent women from living a normal life. The Australian and New Zealand Journal of Obstetrics and Gynecology conducted a study where they asked women about their endometriosis symptoms. And this study generated a huge list of symptoms from women in those countries. And I want to read off the symptoms: painful periods, painful intercourse, pelvic pain, back pain, constipation, premenstrual spotting, infertility, and gastrointestinal problems. Now, some people think that endometriosis only affects you when you're on your period, but that's not the case at all. Some women experience symptoms every single day, and some women have no idea why they have these symptoms because endometriosis is so often misdiagnosed or undiagnosed. So every woman's endometriosis journey is completely different. One woman can experience every single symptom that I just mentioned, and another woman can have none of the symptoms that I just mentioned and have no idea that she even has the disease. So now that we've talked about the symptoms, I want to talk about the complications of endometriosis. There are a lot of life-changing complications of endometriosis that greatly affect a woman's future. The National Health Service website listed some of the complications of endometriosis. And the number one complication that is the most common, unfortunately, is infertility. Some women who have endometriosis are perfectly capable of having their own children. My mom, for example, also suffers from this disease. She had me, and there was no problems at all. But some women, they try for years to have children, and unfortunately, it doesn't work. Sometimes they have no idea what's causing it, like I said, because it goes undiagnosed. And other times, they go through different procedures to get it fixed and it doesn't work out either. And it's really unfortunate, but it seems that the severity of the disease in each individual really determines whether or not you're likely to have a child. So if you have a very severe case, then unfortunately you're not as likely to have a child. And doctors still don't understand why this happens because the fallopian tubes are not affected at all during this disease. So second complication I want to talk about is bladder and bowel problems. There's been cases where women have had to get sections of their bowels removed and sections of their bladder removed because of infestations of endometrial tissue. It completely takes over your organs and it affects the way they operate, and unfortunately that is a big complication. And the last really significant complication, there are so many others that I don't have the time to mention, but the third one I want to talk about are ovarian cysts. Ovarian cysts can be just as painful as endometriosis, and sometimes these cysts can grow huge. They can grow to the size of your fist, and they need to be surgically removed. So that is a very painful experience to go through. So now that I've just talked about the complications of endometriosis, I want to finish up and talk about the different treatment procedures that you can do in order to treat your endometriosis, because unfortunately, this disease is chronic, it's progressive, and it's incurable. So keep that in mind as I talk about this. So despite all of these negative symptoms, though, and complications that I mentioned, there are treatment options available. There are two main types of treatment for endometriosis. There's drug treatment and there's surgical treatment. So the drug treatment is typically the first step in the treatment process. The New England Journal of Medicine, they studied the relationship between oral contraceptive pills and pain during periods. Now, this is the step that I took. I first went on birth control when I was suspected to be diagnosed, because the only true way to get a diagnosis is through surgery, which I will talk about. But I took the pills. It unfortunately did not help me, but it seems to help a lot of women, according to many, many studies. Some patients it works for and others it doesn't. It really just depends. So if the drug treatment fails, surgical treatment is the next step. I got my surgery, like I said, in August of 2018, a laparoscopic surgery in the abdomen region. They do 3 incisions, 1 in your belly button and 2 on each side, and they look for endometrial tissue and they remove it, and it provides relief for a longer time. Ever since I got the surgery, it has helped me significantly. But unfortunately for some women, that does not help either. Since it is a progressive disease, you need to keep getting the surgeries, and if it doesn't work, some women unfortunately have to get a hysterectomy, which is awful. So to close, I talked to you today about endometriosis. First, I went through all the symptoms that you can have. Second, I talked about the complications. And third, I talked about the different treatment options that you have. I want to leave you with a quote from the actress Susan Sarandon, who also suffers from endometriosis. She was a guest speaker at the Endometriosis Foundation of America Blossom Ball in 2011, which is an event that happens every year. And she said, "Suffering should not define you as a woman."